Colposcopies are an office procedure used to evaluate a woman's cervix when there is an abnormal result from a pap smear. Pap smears are screening tools for cervical precancer and cancer, and part of the pap smear is also to test for the presence of high-risk human papillomavirus, which is linked to severe cervical precancer and cancer. The colposcopy is meant to make sure that we are looking for any abnormal cells that exist on the cervix and the vaginal side walls. These cells can range anywhere from mild, moderate to severe precancer, also known as dysplasia, or cervical cancer. And so when we do the colposcopy, women can drive themselves to and from this appointment. We place speculum in the vagina, and we use a solution of 3% acetic acid, which in essence is like vinegar. We use a big Q-tip to coat the cervix and the vaginal side walls. If there are any abnormal cells on the cervix, we can see with a colposcope machine that these cells will turn white, and so it helps us to see where we would do biopsies. If nothing turns white, then at the very least we'll do a scraping on the inside of the cervix, which feels like menstrual cramping for about a minute. The purpose of doing this scraping on the inside of the cervix, also known as endocervical curettage, is to assess the part of the cervix that we can't see when we have a speculum in place. These are all areas that will show up potentially as abnormal cells on a pap smear. So whatever tissue we obtain, whether from the endocervical curettage and or from cervical biopsies, we send this to pathology. We get the results back in about 4 to 7 days, and it will help us to determine what kind of follow-up is needed for your abnormal pap smear. After a biopsy is done, we ask women to hold off on intercourse for anywhere from 1 to 2 weeks, depending on the number of biopsies. I also ask my patients to hold off on exposure to hot tubbing and swimming just to help decrease the risk of infection.